For your health, I'm Kat Carney. If shows like Extreme Makeover have piqued your interest in sprucing up your looks, but you're not so sure about going under the knife, my next guest says that cosmetic dentistry may be for you. And joining me now is cosmetic dentist Debra King. Dr. King's work can be seen on many famous faces, as well as the show Extreme Makeover. Thanks so much for being here.
Thanks for having me.
Now, are you seeing an increase in people coming in wanting cosmetic dental procedures?
Absolutely. The Extreme Makeover has really shown everyone that cosmetic dentistry is for everyone, not just the rich and famous.
And it can be pretty dramatic, and you brought some pictures here, so tell us what we're looking at here.
This is a situation where we designed a smile. This lady had crooked teeth and didn't want to go through braces, so in a matter of weeks we were able to do porcelain veneers and make her teeth look like they were straight.
And she actually looks like she's had some facial work done, but it's just the teeth.
It's just the teeth.
Okay, so let's take a look at another example here. So what was done here?
This is actually, here we go. This is an example of what we call middle-aged mouth. As we all get older and we've had dentistry done over the years, none of it matches, and sometimes it's a darker color. So by redoing her smile, we were able to take 10 years off of her full face by giving her nice white teeth.
Now, a lot of people aren't really clear on what veneers are, and you brought us an example
I
here.
did. This is a model, and I've got a veneer here. So you can see there's a little bit of tooth reduction, just enough to allow for the thickness of the veneer. And the porcelain veneer is actually only about 1 millimeter thick, so it's very thin, and it just fits right over the tooth and fits right on. And this is actually an example of veneers on all of the front teeth.
Now, generally speaking, how much does something like this cost?
Well, it depends on the complexity of the case, but anywhere from $1,200 to $2,000 per tooth.
Wow. Well, what if you don't want to go that deep into your pockets, but you still want to do something, maybe brighten up the smile a little bit?
Well, then we need to talk about whitening, and we have several different options here. We have the day white, which is an at-home whitening, where we actually take molds of your teeth and make a tray, and then you go home and you inject these into the tray, and you just wear it at night while you're sleeping, and over a several weeks period it will whiten your teeth.
And so the results can be pretty dramatic, and you've got a little sheet here that they can actually go from, you know, fairly yellow to pretty white.
If your teeth are yellow, you'll get the best results with whitening. If your teeth are in the brown and gray stages, like if you've had tetracycline, then really veneers are the option, but yellow really responds great with the whitening.
Now, can anyone have these types of procedures?
As far as the whitening, yes, and really veneers, absolutely.
Now, what's the first step? Do you have to make sure that the teeth are completely healthy, or?
We want to make sure the gums are healthy, because that's the kind of the basis that we're building on. But as we do the veneers or any cosmetic work, we're actually taking out all the old decay or any old fillings at the same time. So it doesn't have to be done first and then the aesthetics. We do it all at the same time.
Great. Lots of great options here. Dr. King, thanks so much for your time today.
Thanks for having me.
And for your health, I'm Kat Carney. Back to you guys.